So, welcome into the fourth remedy in this series, that is acute and frequently used remedies, that is the Bryonia. So, what are other three remedies we already discussed? They are the very important remedies, and in this journey, the Bryonia is another very important remedy to use in our day-to-day practice. So, keep watching. Just let's come over to the our presentation area. So let's get started about Bryonia. In the journey of these acute and frequently used remedies. So I'm using this word frequently means in our day-to-day practice, in day out and day in, we need to use this remedy repeatedly. So again, so our same graphical presentation is there. Exciting cause is the important tool to find out the correct remedy, as master said in aphorism number 5 that I am using here only. So what are the exciting causes? Whenever any person or any patient who is exposure to the heat, extreme heat, so at that time we need to think about the Bryonia. Then very typical thing is there, becoming cold after heat. Any person who is exposure to the heat of any kind, and then he suddenly exposure to the cold, means he's coming from city or just wandering from exposure to the sun heat, and suddenly he's coming into the AC. So at that time also fanning after exposure to the heat. If anyone is suffering from any kind of acute situations, we need to think about the Bryonia condition. Then fruit and milk. Most of the time, any person is suffering from any kind of pathology, throat infections or any acidity by after eating this fruit or milk. But mostly, I just observed here that the cold things, cold milk or cold fruits, salads. But after exposure to the heat, what I observe or what I use this remedy repeatedly in my practice. Fasting, then it is another very good remedy, that so many times we didn't get the exciting cause, but we just take the patient history properly. At that time patient said that I just don't eat that day properly, I spent so many time in the my work, but I didn't get my food. So fasting might be the cause of these patients when he is suffering from any kind of fever or any kind of acute situation. So injury and trauma is the very best important remedy for that. Anyone is suffering from minor traumas, minor bruises or any injuries, so this is the best remedy for that. Then fear and vexations, I kept it as a lastly because so it is very rarely, but we can use this kind of exciting cause in Bryonia too. So anyone is suffering from fear or any vexation, so we need to think about the Bryonia condition too. Then let's come over the pathogenesis. So here are, I just want to explain that serous membranes. Wherever there is a serous membranes in all our joints, there is a swelling, there is a effusion. So same thing we just seen into the injury and trauma also. Anyone suffering from injury to the muscle and then is suffering from any effusion into their joints, or either past history of rheumatoid arthritis. So this is the best remedy in that situation also, because this remedy creates the affinity towards the serous membranes also. Then mucous membranes, it the affects on all mucous membranes. And what the mucous membranes he did, this remedy acts on the all mucous membranes and produces the secretions will be get arrested, the drying up. So all their secretions will be get dried up. That's why so many time just prior to the early cases of COVID situation, so many doctors advised about the Bryonia remedy for the COVID situation. At that time, they said that there is a drying up or the arrested of the mucous secretions into the windpipe. So similarly, this remedy works on each and every kind of mucous membrane will be get affected, but there is a secretions are get arrested. Might be dry cough, patient is saying that severe dry cough is there, it is difficult to expel out, very sticky cough. Very same thing we need to understand about the Bryonia pathology. Muscular system, as compared as like to the serous membranes, all muscles will be get affected, rheumatoid inflammation, swellings are there, but it is in an acute remedy. When your patient is suffering from acute condition of this rheumatoid arthritis because of due to this exciting cause, then think about the Bryonia. Circulation is accelerated, temperature is get elevated. It is a remedy for fever. This is the very best remedy for all kinds of fever. So let's come on to the subjective symptoms. So this is the pattern of genuine practical homeopathy. We just enter inside of the remedy according to how we take the case. Unusual peevish irritability. We just discussed into the Naxomica. There is a irritability, angry irritability, but here is a peevish irritability. Means patient is continuously quarreling, continuous irritability is there, along with the angerness is there also. So this is the very typical picture of Bryonia. Then most of the time the subjectiveness of Bryonia is the whatever may be the complaint, patient is suffering from vertigo, and mostly this vertigo is patient is complaining that when he's tried to raising up or either stooping, at that time he is suffering this type of vertigo. He never fell down or anything, but just feeling this vertigo, swaying feeling and all these things. Then bursting type of pressure into the head is there, headache or mostly the forehead. Whenever he's saying that my head is paining or not, he don't know, but he's then my forehead is like a bursting pressure is on my head, my forehead also. So this is the very typical subjectiveness of the Bryonia condition, and most of the complaints of Bryonia are worse by the motion. Patient is saying that when I'm taking rest, my pressure is there, better on the massage, and at that time he feel better. But whenever he try to do any kind of work or any kind of exertion, then he is suffering from his ailments or pathological condition will be get aggravated. Aggravation mostly in the evening. Then very similar thing as we discussed into the Naxomica, early morning aggravations or late there is a dryness in the mucous membranes in the night. Very same thing, we just hear the aggravation mostly into the evening. So dry heat is there, chills are there, pulse is full in the Bryonia. When we just focus onto the physical generals of the Bryonia, what they altered, appetite is increased. As previously into the Aconite and Bryonia, so decrease. In Naxomica, increase. Same thing in Bryonia, it is again increase. Thirst is increased, but in Naxomica, thirst is not altered, we don't know. But in the Bryonia, it is increased always, an unquenchable thirst, drinking too much water repeatedly, frequently, because all the mucous membranes are dried up. Tongue is dry. So throat is dry. Patient is trying to getting moisture in their mucous membranes by drinking lot of water, but still he didn't get satisfied by drinking too much water. So taste is perverted. Bitter taste, or patient is saying that my tongue become tasteless. I didn't able to taste any kind of foods while in the sufferings. And another physical general that is very important is the stool is constipated, mostly whatever may be the pathology, either fever or either any kind of thing the patient is having witness with the constipation. And though most of the time I observe that the patient is having chronic habitual constipation also. At that time also he is suffering from this type of other pathologies, but he is used to for that chronic constipation, and this is the remedy we are able to use that. So this is about the graphic presentation of Bryonia. So friends, so keep watching in the future videos of this frequently used Materia Medica series, but keep it in mind all the time, this is just an entry point. You need to confirm the remedy from Materia Medica Pura. Thank you.